welcome Dr. Dimitri Anastassis.
Thank you, Elaine. Nice to see you.
Now, most of you may not know that the famous Professor Anastassis, Chief of the Department of Surgery at UHN, you now retired, but you at one point you were doing
at
some
the
of
Western,
that.
at the Western, yeah.
Right, Western Division, right?
Yeah.
Is my friend first and foremost, and we spent a lot of time in medical school together.
We did.
And we proudly say that we were the group that was the rowdy bunch at the back of the class.
That's right. Absolutely.
Let it be known that most of us that were in the back of the class is now at the top of our careers. Would that be a fair statement?
I think that's reasonable.
Okay. Now, well, there's some lessons learned that I would like to talk to Dr. Anastassis about, and once in a while I'll slip and call you Dimitri if that's okay, because it's just my habit. And there's some lessons learned that we want to talk about. And I know that from a surgical perspective, you ended up being a plastic surgeon, but has a specialty in hands.
That's right.
Right, microsurgery. But today we're not talking about hands. We're going to talk about the impact of you, of your department, of our colleagues, because of the pandemic. And this is part of our discussion here today.
Sure.
Okay. I admire your grit because you've gone way longer. He's like, here's my resume. How many pages is it?
I don't know. I can't remember.
Okay, I just scrolled and then I had to stop because I was getting me sleepy. You know?
Right.
It was just way too long. But what I want to talk about, first and foremost, is that you made it and there's grit. So tell me how many things you did to become Vice Dean, Chairman of your department at the Western Division, and full professor. How hard did you go? Because I want people to understand how you get to the top. I just want to talk about how you get to the top.
Right.
How much sleep you got or lack of, how much food you ate or lack of, how much exercise or lack of. Tell us what your life was like.
Well, it was busy, number one. So tended to get involved with a lot of things. I also invested in my own professional development. So when I started after my fellowship in Switzerland, within 2-3 years I ended up going to Harvard and did a degree in healthcare management. And then when I came back, I was appointed chairman of plastic surgery at U of T.
Yep.
It involves just a great deal of work and clinically, and then as well in research and in education.
Yeah.
So those three things together sort of position you within your area of specialty.
You mean you're an overachiever in our industry?
Well, I don't know, but maybe
You are.
I was. Yeah.
I'm just telling you are.
Okay.
So how did you do it? Like, how much sleep did you get? Or do you remember sleep?
Well, I mean, you always, sleep was always a challenge because I was always doing call as well.
Yeah.
And in my discipline, when you're on call, you're usually up, sewing something back on, fingers, hand.
Yeah.
And,
arms, feet, whatever.
And then you have to work the next day.
Yeah.
So it was tiring, and took you away from other things like sleep, working out or exercising, and your kids, your wife, your family. So there were some sacrifices that were made.
Do you remember eating, like breakfast, lunch, or dinner? Like, what was
coffee
your
for
normal
breakfast.
routine? Breakfast,
Coffee.
Okay, and then?
Yeah. Usually a sandwich for lunch.
Do you really eat that? Do you order it?
Yeah, from down in the cafeteria.
And then do you eat it?
Most of it, yeah.
Okay, all right.
And then home for dinner.
Okay. All right. What time's dinner usually?
Usually when we had small kids, it was around 6:30.
Okay. And how about exercise?
Oh.
What's
okay.
that?
Spurts of
Okay.
it, yeah. It was
All right.
never consistent, ever.
Okay, so I have to say to you, we had lunch, and there was a reason why we had lunch.
Right.
Tell me how that all came crashing down. Why did you, get rid of all these things in your life the first time around?
Right.
Like, I was shocked, and you were shocked. So tell us what happened and what's that lesson learned there?
Oh, so the first time I think was when I had a very small heart attack. And it made me realize that I was doing too many things.
Really?
So I was had a busy clinical practice.
Yeah.
I was the vice dean at the medical school, one of the vice deans.
Yeah.
I was also with the dean at the time. We started up a simulation network. So I was the CEO and then later chairman of the board. So there were like 3 full-time jobs plus a young family. And I think it was just a bit too much.
Really?
Yeah.
And you said something to me.
Yeah.
You at lunch. Can you comment? You literally said, "But I had no risk factors."
Oh, that's right. The only risk factor I had, my cardiologist pointed it out, was that my height did not match my weight. So I was a bit overweight, but I had, and a family history, but it was always late for people that had heart attacks. So no high cholesterol, no hypertension. I was not a diabetic. I was just a bit overweight.
How much overweight were you?
I'd say 30 pounds.
Okay.
That's a lot.
So I would say that you probably fit a typical profile, whether you're a doctor or a lawyer or a banker or even somebody who's working hard, being an electrician or plumber. I think that would be fair, that you overworked and didn't eat enough or healthy things and
typical workaholic. Doesn't matter if you're a surgeon or a plumber or a carpenter.
So here's what I'm going to say back to you, because I didn't say this at lunch to you. I know I love you to death, and you said you have no risk factors. But your biggest risk factor was fatigue. And so what we see on my side in personalized medicine is that when you're fatigued, your cortisol levels drop to flat. Okay, and I can measure it, whether I measure it in blood or saliva. So I would gather if you were in my practice earlier, I would probably catch it and stop it before it got to an inflammation point where your artery went into spasm and locked you out, right? So you did one good thing. Which was more than one good thing.
Well, yeah.
So what did you do beyond?
I decided to do only one thing, and that was to be a surgeon.
Great.
I gave everything else up. Yeah.
Okay, so then the second thing, the second story that I want to talk about really is we had lunch, but I sent you a text message about a patient, because we do this all the time, you and me. And you said, well, I have lots of time for lunch after I retire in the next couple of weeks. Now, I know it might not come as a shock to you, but it comes as a shock to me, because this is my friend Dimitri, who is just always driving forward, right? Thrusting forward, doing whatever. And for you, in your early 60s, are you 60 yet?
Yeah, I'm 61. I'll be 62 at the end of
And
the year.
we're just colleagues, so.
That's all right. It's okay.
It's okay?
It's a number.
It's a number. You're at the prime of, I guess, your expertise, your experience. You have so much to pay for, which you love, because before you got into medical school, you were one of everybody's favorite teaching assistants. Remember in class, they go, oh my God, Dimitri's one of our classmates, right? And I remember that. I didn't have the privilege or not privilege of having you as my TA. I would never know. Were you a tough TA?
No, I don't know. It was a good one, I think.
Okay. So tell us what happened, because you got bit. You got bit. So in a nutshell, you ended up in the ICU.
No. I got sick. I started to feel unwell, and I took a train to Montreal to visit family. And I got very sick that night. And my wife said, "Oh, better get a COVID test." And I got swabbed on a Sunday, and came back positive. So I called a colleague of mine who's in infectious disease at UHN, and he said, "Well, you better stay and not take the train for at least another 5 days."
Okay.
So I stayed in Montreal for a bit, and then came back home and went up to the farm and spent about 10 days there.
Right.
And it wasn't too bad.
Okay.
It was just cough and...
Just typical.
Yeah, nothing much. And came back to work.
Yeah.
And within, I think it was 3 to 4 weeks, I can't remember exactly, I got real sick in clinic.
So what do you mean by real sick? This is how many days after COVID. So technically you're post-COVID, like if you recovered, right? Would that be?
Yeah, essentially.
Yeah.
But I was kind of pale. This is what people were telling me. All the hand therapists were sort of hovering around me, and I said, "Do I look that bad?" And they said, "Well, we know you really well, and we think you should lie down." So they got me to lie down, and my colleague, Dr. Balzer, I think she called my wife, and I ended up in Emerge. And I had the option to stay or go home, and I said, "Oh no, I'll go home." And it was pure hell after that for about 3 months until they sorted me out. And everything was wrong. All my blood work was abnormal. But interestingly, you know, some of the symptoms, when they worked me up for my respiratory problems, all the investigations, including CT, MRI, pulmonary function, everything, normal. Normal, no clots, no fibrosis, no abnormality in my pulmonary function.
And why do they do that? Because
I was short of breath.
And are you still short of breath?
No, that's much better now. I will get short of breath if I'm overdoing it, or if I get stressed or work too much. But that's much, much better, having done all the therapy with the physiotherapist. So that's better. But I'm left with a whole bunch of other fun things.
So what are the fun things? Because we're going to kind of give it a label at the end of this. What other fun things are going on in your body?
Well, I have what's called Covid-induced dysautonomia, which means that my autonomic nervous system is a bit messed up. So I could be sitting at my desk and my heart rate will drop to 40. Sometimes you get a bit lightheaded, bounces back. Diastolic pressure fluctuates, kind of a wild thing.
How about your memory?
Well, there's the brain part is really quite interesting.
Okay, tell me about that.
The memory's fine, I think. Well, maybe not. I forget things.
If you can remember it, if it was fine.
No, you know what? It's bad because sometimes I say, okay, I need to go into the pantry to get flour, and I walk into the pantry and I go, well, what am I doing here?
Well, maybe you're pregnant.
Yeah, no.
Foggy brain pregnancy.
Right. The other thing was I could read like a PhD thesis, 300 pages in a day, 2 days, and make notes and summarize it for the student. And I couldn't read my student's thesis for the life of me. It took me 2 weeks to go through it. Yeah, so that was a big difference. It's getting better slowly.
Okay.
And the other thing too is that people forget that when you're thinking, whether it's reading or analyzing or coming up with something in your mind, that consumes energy. That's work. And you can't do that.
So it's fatigue.
Exactly.
Okay.
And you can get tired from that if you just do that. So it was really quite a challenge while I was off. So when I was put on medical leave April 1st, and I stayed off work until October. But all that mental part, the cognitive part,
right,
was a real challenge.
That's what they say, because in fact what you have is long COVID.
Right.
Right. So what I learned in writing my book was that most of long COVID is somewhat abstract, that there about 25% of people have fatigue, and another 20 have memory loss or brain fog. So I'm going to ask you your thoughts on that in a minute. Why? Because I've been reading something more so lately. And then comes the shortness of breath, which is about a third of the population. And I'm just curious whether you also have the aches and pains and the sleep disturbances.
Sleep for sure.
What's happened? What's different?
Before I would lie down, my head would hit the pillow and I'd be gone, out to sleep. Now it's a challenge. I can go without sleep for 2-3 days, which isn't good, because I just can't fall asleep.
Wow.
Yeah, that's very different for me.
Okay.
And that has, ramifications for you if you're always tired.
Right.
Because one of the most important things you can do if you have long COVID is to relax and rest. 2 things I don't do well. But
it's even worse now, right?
yeah.
Okay.
So
How about those
that was
aches and
challenging.
pains?
So that happened to me early on. I developed COVID-induced polyarthralgia. So almost every joint in my body was inflamed, swollen, and very painful. And if I had had an injury, so I had a rotator cuff lesion here, I ruptured my biceps tendon, I had a remote ankle and a remote wrist injury.
Yeah.
The joints that I had injured, even when I was a teenager,
Yeah.
were
Blew
so
up.
painful, so painful. It was as if I just re-injured them, and that really was quite something. So for about a week, I couldn't take my shirt off. I had a hard time walking up the stairs. It was very unpleasant. And then my doctor, Dr. Chung, suggested I go on colchicine. And I said, well, I don't have gout. Why are you putting me on colchicine? But apparently it's an anti-inflammatory that works well in patients who have COVID-induced polyarthralgia or arthropathy. So I went on it, and it was like a miracle drug. And the aches and pains all settled.
Okay.
It was good.
So now I'm going to flip channels on you and say, what would you say to patients? Because as a primary care doctor, I'm now realizing that a lot of my patients are coming into me with what I would call historically abstract symptoms, and especially the things around fatigue and memory, or just brain fog, or
Even
all
the,
these
even
other
the
things.
myalgias and
Yeah.
arthralgias, though, it makes you think of fibromyalgia,
Yeah.
which has bad rap,
Yep.
which
And
is
so
bad in itself.
patients are having trouble finding out what's the cause. Now, most recently, I just read an article that scared the EBGBs out of me, that showed that the MRI of people who've had COVID, whether mild or severe, but died of another reason, and then they, looked at their brain from a pathology perspective and induced some dye in it, that they're literally spike proteins still lighting up in the cadaver brains.
Wow.
Do you think this is like an example of maybe we've got all these little spike proteins, and by the way, to be clear, that's not part of the injections. It's not part of our immunizations. It's not part of the vaccine. This is because people got sick, because the people that didn't get sick and had vaccines didn't have these things going on. Do you think that there may be something there? Because how do you treat this? How do you treat spike proteins in your brain?
I'm just a plastic surgeon, but
Pluck them out?
yeah, I think there has to be, because I had all 4 shots when I caught COVID, there has to be some type of genetic predisposition. There's something that allows the virus to come in.
Kind of like shingles, do you think? Like it kind of hangs out?
Well, some people believe that there is a viral load that persists somewhere. It's hidden, we don't know. Or there's an element of the virus that we just don't know anything about, that is the source or cause of it. But there has to be, I think, something about you that allows the virus to come in and do the damage it does. My doctor that took care of me, the doctors that took care of me, all suggested that I had no bandwidth to fight the infection because I was fatigued, tired, exhausted. And the virus won, and it really just decimated me. So that was another factor that contributed to it. So I think if people are walking around with a genetic predisposition, and at the same time they're exhausted or fatigued or stressed or whatever, perfect for the virus.
Storm. Yeah.
For the virus, yeah.
So you also told me that some of my classmates are retiring. And we hear in the articles in the newspaper that nurses are burned out, family doctors are burned out, we're all retiring. And given that you're in a major teaching hospital, I'm going to ask a real dumb question, but is it real that people are exhausted, burned out, and retiring?
Well, there's no question. Our nursing colleagues have taken a huge beating, and the doctors as well, and the allied health.
Yeah.
Everybody.
Everybody.
And I know personally, a lot of my friends, nurses, allied health, and doctors, are stepping down.
I know, you told me some of my classmates, like all of us are in our prime. Like this is where we should be able to contribute, right? In a post-pandemic world, so to speak, right? With all these extra patients on board, right?
Yeah.
So what's the solution? Because you were going to be, I was hoping you were going to be dean one day and bring me on to do some teaching. But if you were dean, what would you tell the medical students today going to university, I should say medical school? What lessons learned from your personal arc in your career, what would you tell them today?
Well, I would tell them that it's still a privilege to be a doctor and to serve your community, and that there's nothing greater than being able to do that and to help people. But you're not going to be a very good doctor if you're tired, if you're sick all the time, or if you don't have the strength to stay up at night and operate, or to take care of people in the ICU. So you have to take care of yourself first, so that you can take care of your patients, but also take care of your family.
Yeah.
And if you let that go, then you're not going to be any good to anybody.
I know, and I'm gonna try and keep working on my side, right, to help people
Get better.
What would you tell patients today? Because we've just gone through a whole bunch of signs and symptoms of long COVID. Is it real? Is long COVID real?
Absolutely, it's real. So there's no question that it is a true entity, and we're just coming to really appreciate what it is. And I think as the basic science unfolds, and we understand how the pathophysiology and then how to treat it, it will become a diagnosis that's more accepted. I do think there are still doctors out there, one, that don't know anything about it, and two, who may know a little and really don't see it as something that's real.
Because the problem is there's no test that shows up abnormal if you didn't whack out half your heart from myopathy, if you didn't whack out half your kidney from nephritis.
Right.
So what advice would you give patients today if they're having these symptoms?
Well, find a doctor who has an interest in it, in long COVID, and that has a practice that focuses around patients like that. And each of the teaching hospitals, I believe, I know that St. Mike's and Toronto Western have long COVID clinics. And I know you have an interest in that as well. So find the right doctor that can help you. And if your family doctor can't, because he or she doesn't know anything about it, then...
Or doesn't have the time.
Well, that's the other thing too, right? We have multiple symptoms. We're like, that's a lot of work for one doctor.
Yeah, so we need an integrative health team to deal with this, right?
I had 3 internists looking after me.
Wow. Is there something else that you'd like to tell the audience, given that you're a teacher, you're an educator, you are a long COVID survivor, and a dad, and a friend? What am I missing that I didn't ask you, that you want to share?
Well, I think my last 18 months has had an effect on my family. My relationships with my kids, my wife, my cousins, everybody. One, they were all worried. And I think it does affect your mental state. So if you have it, you should be particularly careful. You know, my general internist, Dr. Abdullah, said, "Oh, you better speak to a I want you to see a psychiatrist."
It's too late for you, really.
Yeah, I said, "Oh, that should have happened 40 years ago."
I know, I would agree.
But,
you should have told her.
It was probably one of the good things that I did.
Yeah.
It just helped me see, wow, that's a lot of stress.
Yeah.
Having to deal with this, closing your practice and all this stuff.
I
You
know,
know, and I
yeah.
always said to I said, I'm very grateful that this has happened to me at the end of my career.
I hear you.
I plan to retire before 65. And my kids are all finished university and they're set. And it would have been awful if this had happened within the first 5 years of my practice.
Yeah. And I
And
guess
it has
it's
happened.
happened to other
It's
people,
happened
whether
to
it's a practice or
Practice,
somebody
or
else's
they're
careers.
a businessman, a banker, whatever, doesn't matter.
Yeah.
You know, if they're young, and if they don't have disability insurance, wow, that is a big problem.
Yeah.
And if they're the primary breadwinner, and they don't have disability, they have small children, and both parents work, wow.
Yeah, thank you for bringing that up, because not all insurance companies are recognizing this abstract diagnosis of long COVID because you can't prove it.
Yeah.
So it is a problem.
I'm fortunate, mine does, Manulife, but they're very good. And, you know, there are things that are, patients with long COVID don't have perfect lab results. They don't have perfect investigations. There are abnormalities that do show up that support the diagnosis. But yeah, it's very hard, whether you're young or old, but it's really, really, really hard if you're young, starting your work career, starting a family, and you didn't see yourself needing disability insurance when you're young. That's for old people, but hopefully.
Yeah, I hear you.
It's scary.
So here's what I'm going to do,
Okay.
if you, with your blessing.
Sure.
I'm going to try and help you build your strength back.
Okay.
So the good news is I don't need to help you lose weight, because we knew that.
I know. I dropped 60 pounds thanks to loss of taste and smell.
Right. Wow. So as we know, obesity increases our risk of complications to COVID. So somehow this kicked in for some people. And it was really interesting. One of the reporters that was talking to me about my book literally said to me, "Are you shaming obese people?" And I had to back up and say, I'm not shaming people with obesity, just to be clear. I'm telling people who have obesity that it is an independent risk factor to not only long COVID, but a whole slew of other things.
Sure.
And then because it's inflammation, curious, before this, do you eat a lot of fish? Do you know what your omega fatty acid levels were? Do you know what your vitamin D levels were? Because people who were not in the ICU seem to not have a deficiency in those two nutrients because they're natural fat-soluble anti-inflammatories. So just curious in terms of your cardiac, pre-long COVID lifestyle. Did you incorporate that vigorously in your lifestyle?
I'm a Greek. It's
What was
a
that supposed to mean?
Mediterranean diet. So yes.
Great.
Yeah.
Great.
All of us in my
All
family.
right.
So. And too much of it.
And too much of it. Maybe that was part of it. And how about exercise? What was your exercise routine like?
I thought I was fit. You know, I maintain a 100-acre farm, and renovating the house and restoring the fields and the forests and taking care of the trees. So I was very physical every day. Now, I may not be on a treadmill or running.
Right.
Never ran.
Right.
I will never run.
Okay.
But
I won't get
I
you
swam
All right.
regularly. So I thought it was reasonably good shape. You know, I had a resting heart rate in the 50s.
But now it's up and down, eh?
Oh, it's crazy.
Bouncing ball.
Up and down.
That's probably another symptom. But. Well, thank you for your time.
Thank you for having me.
And thank you for sharing with the audience that
Pleasure.
lessons learned here is even though you may have no risk factors is burnout. And it's real.
Yeah.
And even if you had 4 shots and you can have COVID, especially still now, in a post-vaccine world, you can still get long COVID. So maybe Paxlovid is an important instant drug. I don't know what would help with long COVID. And the third lessons learned is it's never too late to eat better, sleep more,
Absolutely.
and stay active and exercise to stay healthy so that you never know what's around the next corner.
Absolutely.
So thank you, my friend.
Thanks, Sandy. Nice to see you again.